As I was about to say, I'll bend down a little bit. I want to thank Tanya, Kim, and Dr. Hunt, Dr. Nera, and Dr. Hart. A lot of doctors here. Dr. Hart here. It's going to share some few words about what we're trying to announce today. I first want to sort of root us in the purpose of our investments that we're talking about. So when we look at public safety, yes, the obvious thing is we're trying to do is keep them safe, and we're talking about less violence, or the absence of violence, the absence of blood, the absence of trauma. But we're also talking about the presence of opportunity, the presence of promise, the development of hope. And so these concepts are certainly intertwined, because for these children, these young adults, to grow into who we want them to be, they will need both. So this brings us together today to define our One Seattle Public Safety approach, building on a continuum of prevention, intervention, restoration services, so every neighborhood is safe and every person is supported. We believe in our administration, safety is the foundation for everything we want in Seattle, and requires more than just responding after harm is done. It requires us to align all of our systems, all of our investments, all of our talent. That would include schools and law enforcement, healthcare, human services, to foster healthy and hopeful communities. The sad reality of this country is that gun violence is a serious American problem. Seattle, of course, is not immune to this. There are too many guns on our streets, and it's too easy to access them, and the consequences are devastating. A week or month has not gone by where I've not talked to a person affected by gun violence. This year, for example, the Seattle Police Department has already seized 1,380 guns. That's 5 a day. And that's a 33% increase compared to the same period last year. Now, while we are making progress with violent crime and homicides are down this year, you've heard me say this before, one life lost or one person shot is too many. So before we go further, I want to think about where we're standing right now, why we chose to come here at Garfield. Last year, we all know that on the steps here, Amar Murphy Payne was killed. I've had a chance to talk to his family members, and we honor his life and remember he was much more than what happened to him. He's inspired many of us to be better and do better, and certainly that should have never happened. But it's not just Garfield, and tragically it's not just Amar, it's across our city where we're seeing this kind of gun violence. This Garfield, I think many of you know, I not only went to school here, but my mother and father met here. Some of my best memories were here in this school. Today I am announcing nearly $15 million for community safety investments. This is a critical strategy designed to help prevent violence before it starts. So the request for a proposal officially opens tomorrow, September 28th, for community-based organizations to apply. As you know, many of these community-based organizations have lived experience, technical training, the heart, the commitment, the intellect, the drive, the credibility to do this kind of work. They are our partners, and we cannot do this work without them. These investments will build on and work in partnership with our broader public safety ecosystem. The Seattle Police Department's crime prevention and harm reduction work in neighborhoods, our CARES civilian crisis response, our school-based safety and mental health supports, our hospital and community-based programs, our neighborhood ambassador and outreach programs that connect people to services and care. This is peer-to-peer work that is essential, and our upstream investments in food, education, health, and employment. We understand how difficult, if not impossible, it is to learn and optimize who you are as a human being when you are living with trauma. What makes this work distinct is that it reaches people in ways government and traditional law enforcement cannot. That's why it's a critical part of a complete public safety system. And we know this work is rooted in relationship and trust. These strategies only work when they are invested in consistently and at scale. Small pilots or one-offs will just not work. certainly not to the degree we need it to work. Gun violence is just taking too much from us, physically, emotionally, spiritually, and we want every system and every partner and every neighbor to know how much we are invested in our children, our young adults, our elders, our teachers, our administrators. They're clearly worth the investment. So with that, you're going to hear a little more detail from the next speakers. I will invite Tanya Kim to take the microphone, our Director of the Human Services Department. Tanya, the mic is yours.
Good morning. So I'm with the Human Services Department. Consider us to be the social services branch of the City of Seattle, long-term supports that we offer. Thank you, Mr. Mayor. I'm yelling here. I don't know if you can hear. No? Okay, I got a thumbs up. It's not green. It's red. That's why. One moment, please. Oh, well, hello. The Bluetooth. Okay. I think it just cut out, right?
It's just technology. Just keep going.
Technology. Okay, I'm gonna yell. So we're with the Human Services Department. My name's Tanya Kim, and consider us to be the longer-term social services for the City of Seattle. And we do this through direct services as well as investing in our community-based partners, because we cannot do this alone. There's a lot of expertise out in the community. As Mayor Harrell announced, the Human Services Department is pleased to release the Community Safety Request for Proposal that is tomorrow, September 23rd. Through this new model, we are investing in a range of gun violence reduction services. Our services focus on specific neighborhoods, schools, and Harborview, where survivors and victims of gun violence are treated. We will provide concentrated services for those most impacted by gun violence. Now, how did we develop this request for proposal? I'll shorten it by saying RFP. We did our homework, and we listened deeply to community. Some of our community members are here. My team studied Oakland and Baltimore initiatives where they've seen successes, and we sought academic review from the University of Washington Firearm Injury and Policy Research Program. Again, we have subject matter expertise here in our community as well. We examined the strengths of our current investments, and we identified areas that need to change. As part of this change, we are intentionally aligning with our key partners, many of whom you see here, but many of whom are not here. With deep planning, we included the Department of Education and Early Learning, Dr. Chappelle. We included our Seattle Public School District. Dr. Howard is here. We have our Seattle Police Department. We've got a lot of doctors, Dr. Hunt, Mayor's Office, Public Safety Leadership, and many others. And over the last year, we've held over 10 community engagement sessions. We have listened to community. The Community Safety RFP implements several notable improvements, and let me talk about that. First, focus. We'll continue place-based services in Central, Southeast, Southwest neighborhoods, and we'll expand to North Seattle. Our selected providers will offer intervention, school safety, and supportive services. Second, accountability. All selected providers will have the same North Star, and we will have clear reporting requirements. To this, we are also setting aside some dollars to make sure that we have an external evaluator to hold the work accountable. And third, quality. We are investing in the providers around workforce development and around a strong network. What this means is that we are going to provide the capacity for our providers to be excellent through technical assistance, training opportunities, certifications, and we're going to ensure that there is consistency and of high qualities across the city. So what you receive in the south end should be similar to what you receive on the north end while catering to the needs of the community. In short, this request for proposal process will ensure we are contracting with a set of providers who are committed to a shared model and vision. With that, I do want to close with gratitude. I am grateful to our partners, including community-based organizations and community members who have been doing incredible work for years. No one agency, no one department, no one person can create safety on their own. And there is rich subject matter expertise and strong leadership in our community. Together, in partnership, we will deliver safer pathways for our young people and their families across Seattle. Thank you.
Thank you, Tanya. Thank you, Tanya. Thank you very much, Tanya. Next, you'll hear from Dr. Lee Hunt, who is our Crime and Community Harm Reduction Executive Director for the Seattle Police Department. Dr. Hunt, you have the mic.
Good morning, everyone. I am Dr. Lee Hunt, and I have been with the City of Seattle for 6 months in the new role as the Executive Director for Crime and Community Harm Reduction. I'm a criminologist and an anthropologist. For 2 decades, I have been successfully applying evidence-based strategies to mitigate violent crime. I know from experience that police cannot do this alone. To reduce harm in Seattle, we as a community need to create meaningful and sustainable partnerships. The evidence that partnerships work is overwhelming. Community safety investments facilitate and generate those partnerships. One of the programs that work particularly well is community violence intervention. It is evidence-based strategy that effectively reduces gun violence and builds a web of partners preventing, intervening, and supporting those at risk. Now let's be clear. Gun violence is a real issue in the city of Seattle. People are concerned. They tell us they're concerned, and they are worried. And we, all of us here before you, are concerned and we're acting. SPD is now holding twice a week meetings dedicated to analyzing shots fired in a park, robberies with a firearm, or senseless homicides. Let me give you an example of our findings. In the first 6 months of this year, police arrested 17 children for carrying a gun, meaning they had it either on them or in a backpack. And one of those children we arrested was 13 years old. 2 of those children were 14. Why? Why are middle school students feeling the need to carry a firearm? I mean, there is nothing more important than preventing our community's children from picking up and using a firearm. In 2020, firearms became the leading cause of death for children and adolescents in 2020. More so than diseases, more so than car accidents. It's guns. Under the Seattle-centric policing plan and the Mayor's One Seattle Restoration Framework, SPD is committed to working with every city department, every community group, service providers, public health providers, and schools. We will stand shoulder to shoulder with anyone and everyone to assist in addressing this issue. We're working towards a united goal, reducing gun violence to its lowest possible level, and certainly not having our children killed or injured by gunfire. While crime levels are down this year, we continue to focus on illegal possession, and our gun violence reduction unit and our patrol officers, as the mayor mentioned, have seized a large number of guns this year. Our fatal shootings are down 39% this year, and that's just the beginning. And with plans like this is how we're going to do business moving forward. Investments like this and working partnerships will reduce the use of firearms by the most vulnerable at-risk populations, our children. Thank you.
Thank you, Dr. Hunt. Thank you, Dr. Hunt. Next, you'll hear from Dr. Tarance Hart, of course, the principal here, and he sort of epitomizes the kind of relationship I think a mayor should have with a principal. We talk frequently, and he always puts the kids first. And so, Dr. Hart, please share a few words with us.
Good morning. As the mayor said, I'm Tarance Hart, the proud principal of Garfield High School. This is my 5th year at Garfield. And Garfield is a much different place than it was when I arrived here. And much of that is thanks to the commitment by the city to ensure that we have safety and supports for our students and families, as well as some of the investments by our district in the form of additional security specialists and adjustments to our physical building to ensure safety in the building and to keep anyone who wants to do harm to our students out of the building. So we're grateful for that. This partnership is based on safety and learning are inseparable. That's a fact. In order to create an environment where our students are able to learn, to flourish, to grow, to become adults that are ready for college and career, it is completely necessary that we keep them safe in order for them to receive the education that they deserve here at Garfield. I want to highlight some of the benefits of the partnership with the Human Service Department. And this partnership has always been about coordination and alignment and not just funding. But how do we take these resources, coordinate them in a way that best supports our students? And with an emphasis on the One Seattle approach, which is about schools, families, community, and the city working together to achieve these goals. Here at Garfield, what we didn't have 3 years ago that we have now are case management. That was part of this sort of initial investment. We have case managers who are immediate trusted adults for our students and families. They work with students on a daily basis to address the needs of our students in attendance, in academic supports, mental health, behavior. So that case management is such a significant investment here at Garfield and such a significant sort of tool that we use here to support our students. We are also fortunate to have safe passage with trusted adults. You know, students have adults that they can trust outside of the building during passing periods, but particularly during lunch and after school. So there's adults there that students can see every day that are there to keep them safe and to watch out for any players that might not be here for the good of our students. We're also fortunate to have the Family Resource Fund. That fund provides stabilization to families who are in moments of crisis, who have financial needs or have needs in the immediate. And we are fortunate to have the funds that we can sort of support those families when they need that support. I'm also grateful for the violence interruption. We have violence interrupters in our building, and the goal of these individuals is to build relationships with students, but also prevent escalation and reconnect students when they return to school, and be present in the hallways to be additional trusted adults for our students. And we're grateful to have those individuals in the building sort of working along with our admin team, our staff, and our security specialists to keep the hallways safe. And we're fortunate to have, through our partnerships with Deal, and thanks for Dr. Dwayne Chappelle, because we have expanded mental health capacities in the Odessa Brown Clinic. We have two new mental health specialists. One is a black man and one is a Spanish-speaking woman. And we're grateful to have just that level of diversity in our Teen Health Center to provide mental health supports to our students. We're also fortunate to have the King County Behavioral Health Coordinator who takes our referrals, has access to our community-based organizations that provide mental health supports for our students and connects students with the mental health provider that meets their needs. That's a significant sort of resource that 3 years ago was not here at Garfield. So our students are in a better place because of these investments that's made by HSD and Deal, and we are grateful for that. We see already early progress. Last year we had no gun violent incidents on campus, and I can attribute that, absolutely. And I can attribute that to the fact that we have more trusted adults in the building. We have our safe passage staff outside of the building, and all of those, along with our focus on restorative practices, also our focus on building an MTSS system that sort of supports our students in a real way and progress monitor our students so we can make sure students are receiving exactly the interventions that help them to get better and to be better and be more prepared for the world that's outside of Garfield. I also want to take an opportunity to honor the students that we have lost. Amar Murphy Payne, Solomon Taylor, Salvador, AKA Jr. These are Garfield family who we lost because of gun violence. Their absence is deeply felt by their classmates, by our staff, by our entire community. Their lives matter. And this sort of investment is just one example of how we're trying to do things different so we can have different outcomes. So I want to just reemphasize, safety and learning are inseparable. They go hand in hand. We can't have one without the other. This $15 million investment, we've seen the results of that investment and how our school, our students have been impacted with more resources because of those investments. And I also want to always remember, One Seattle is about schools, families, and the city working together. And that's what I think this RFP is about, is how can we work together to continue to make this place better and to provide our students with every opportunity to be successful and safe. And I want to end with this. The goal of Garfield is to have every student safe, supported, and able to thrive. And investments like this, along with some of the other work that we're trying to accomplish inside the building with our community-based organizations and with these investments that have been provided to us at Garfield, I think we're on the right track to really make some changes and to really make Garfield the place that we all know it has been and it continued to be. So we're excited and grateful for these investments. Thank you so much.
Thank you, Dr. Hart. So our last speaker will be Laura Johnson, the Clinical Program Manager with Harborview's Violence Intervention and Prevention Program. And Laura, thank you for joining us. We look forward to hearing some words from you.
Good morning. My name is Laura Johnson. As Mayor said, I am the Program Manager for Harborview's Violence Intervention and Prevention Program. Our program supports patients and families after a firearm injury, and we are the hospital-based intervention component of the community's response to gun violence. We are part of a continuum of intervention that must occur in order to disrupt violence in our communities. Our program relies on the support of our city partners, the strong support of the King County Regional Office of Gun Violence Prevention, the Washington State Department of Commerce, and our dedicated relationships with our community partners. Our community-based partners must have consistent and sustainable funding so this vital work can be continued. With consistent community-based funding from the city, county, and state, programs will be successful in building healthier and safer communities. Thank you so much.
Thank you, Laura. Just to wrap up our planned speaking portion and be more than happy to answer a few questions, I think what you're seeing from both the talent that spoke and hopefully in my words, this fully holistic approach to not only saving our children, but optimizing who they want to be in life. And at the end of the day, that's what life is all about, is trying to pass on whatever gifts we have, whatever advice and talent we have. I'm very glad you're here too, by the way, to the next generation. And so that's what we try to do in our public safety investments. And with that, I'd be more than happy to take any questions that you may have. Yes.
So you mentioned that the mission of this partnership and this funding is in part to partner with community organizations that law enforcement or the city may not normally be able to connect with. Could you speak to how those partners will be tracking their success and the city's involvement?
Yeah, I'll repeat the question. The question is, thank you for coming, is how, with these community-based organizations, how do we measure success? How do we track success? How do we make sure that we're using our tax dollars wisely, and what are the outcomes we're trying to drive? That's how I sort of interpret the question. Can you address that, Tanya, if you'd like?
Yeah, I'll give you one example. We have some core outcomes that we expect to see. I'm sensing that the noise is fighting against me. Can you hear me okay? Okay, all right. So we're going to be tracking some basic outcomes. We have, Dr. Hart gave a really good example. He gave you some data already about, with our investments here at Garfield, how there was improvements in school safety. There are regular reports and that's gathered, and so students, for example, are sampled to measure how safe they feel at school. those are the types of measurements that we're going to attribute to the work that we do in the 11 schools that we're committed to. We'll have reporting metrics, and so we'll track those that we serve, of course. We will also track the dosage, if you will, the intensity of the services that we're providing to those that are referred to our programs. And we're going to be measuring all of the successes. And so, did that young person get into the sport, and were we able to fund all of the gear? So then that way, they're after school, they're participating in something that's really positive and building a family outside of perhaps what was competing with their attention and pulling them in a different direction. And so those are the measures that we're going to be tracking. But that said, as a reminder, we are hiring an external evaluator. And so with that subject matter expertise, we're going to refine the metrics and make sure that it's standard across all of our contracted providers. Right now, what we have are really good investments, but it's not standardized. And so you'll see in some contracts, they're measuring their performance with maybe their 30 or 15 young people that we're working with. But like the mayor said, we need to move away from pilots and scale programs based on evidence-based practices, based on the trainings that we've developed, and then have a dashboard where we could say uniformly throughout the city, these are the successes that we've received. And so we're going to be fine-tuning that development with the researcher on board.
And thank you for that, Tanya. And I think this was implicit in the answer, but let me make something very clear. How do you measure how someone feels sometimes? I'm looking at a few young folks, a few bulldogs here. How do they feel when we're making these investments? Do they feel safer? Do they feel more that they're heading in the right direction in life? Or do they fear, are they fearful or traumatized? So we will talk to the students, we will survey them, we'll talk to them and get their feedback constantly, and that's part of the database approach we do. We talk much about how many guns we retrieve and how many lives we're hopefully trying to save, but we also have to be vulnerable and transparent with the teachers and the students to see how are we doing, and we're never afraid to have those conversations. So thank you for your question. Any other questions? Just one sec. I'll talk offline for non-press. Okay, I'm not going anywhere. And if no one asks a question, I'm going to come right back to you and close it. Yes.
I have a question for Dr. Hart.
Question for Dr. Hart.
You spoke about Garfield and many students in the larger Seattle Public Schools community are still dealing with and living with the trauma of gun violence, not just at schools, but in their community. You spoke about what this funding will do for Garfield specifically, but I'm wondering if you can talk a little bit more about what trust building looks like in the community, not just with students, but also with parents who are still actively dealing with the trauma of gun violence.
Yeah, I mean, it's an ongoing process. I mean, I don't know. When you have a school community that over the course of several years has had to deal with community violence that directly impacts that school community and the students and the staff and the families. It's an ongoing process to heal, and many of us in this building are still experiencing some strong residual feelings and PTSD and trauma from what we've experienced as a community. And that's why I think one of the things that we can do and one of the things that we're focusing on is building student community, making the student community as strong as possible, and really allowing students to sort of lead the work to rebuild the culture here. And that takes building trust with families. That takes ongoing family engagement, where the school is being proactive to create those opportunities to engage families. So I think that's what it looks like. Continue to build, to gain trust by being transparent, by informing parents about what's happening here at Garfield and some of the resources that we have, and by slowly getting their feedback and using their feedback to really impact the work that we do here. And I think that's how you build trust, is to listen to families, listen to students, and have ongoing engagement opportunities where we listen to them and we're responsive to what they say their needs are. Thank you.
Thank you, Dr. Hart. So I'm going to thank all of you for being here. And I'm going to talk to a few students, because if there's one takeaway from this event, in addition to it being an integrated, holistic approach, that we will always listen to the students and try to meet them where they are. So I'm going to have some conversations with them, and I want to thank you, and I want to thank the speakers for wrapping it all up for us in a very holistic manner. And we're moving forward to keep everyone safe, because that is our charter responsibility. So thank you for being here, and look forward to seeing you throughout the rest of the week. Thank you very much.